Welcome to your recovery. Healing from an arthroscopic rotator cuff repair is a 6-month marathon, and getting your shoulder back to full strength requires absolute adherence to a strict protocol. This diagram lays out your 5-phase, 26-week timeline, progressing from protecting tissue to returning to sports. Notice the milestone gates between phases. You only move forward by meeting strict clinical criteria. Decreased pain doesn't mean the tendon is ready. Before starting, you need 3 things: official clearance from your referring surgeon, a properly fitted immobilizing sling, and essential home exercise equipment, like pulleys and elastic bands. Think of this protocol as a non-negotiable roadmap. Following these steps exactly as prescribed is the only reliable way to protect the repair from tearing again and guarantee a safe return to your normal life. Step 1 is Phase 1, spanning weeks 0 through 6. Your sole objective during this time is protecting the surgical repair while the initial healing begins. You must keep your arm in the sling full time. You are only allowed to remove it for approved therapy exercises or basic hygiene, like showering. During this phase, you will perform passive range of motion exercises. This means using gravity, or your opposite healthy arm, to move the healing shoulder. You are moving the joint without firing the muscles attached to it. The only except without stressing the delicate tendon. Under no circumstances should you attempt active range of motion. Flexing the muscles to lift your own arm during Phase 1 will pull the newly sutured tendon directly away from the bone, risking a complete failure of the repair. At the end of week 6, if you meet the clinical criteria, you enter Phase 2 and officially discharge the sling. You will now shift to active assisted range of motion, or AAROM. You will use tools like a cane or an over-the-door pulley to guide your arm upward, allowing the shoulder muscles to engage slightly with plenty of external support. The physical limits in Phase 2 remain strict. You cannot lift any object heavier than 5 pounds, and you must never use your hands to push up out of a chair or support your body weight. Adhering to these passive and assisted limits gives your tendon the uninterrupted time it needs to biologically fuse back to the bone without mechanical disruption. Phase 3 spans weeks 10 to 14. Your shoulder is finally cleared for active range of motion, meaning you can move the arm upward under its own power without external support. This diagram illustrates submaximal isometric strengthening. You will gently engage the rotator cuff by pushing your arm against a wall without full exertion or movement. This builds early muscle tone while keeping stress on the joint very low. You can handle light daily tasks like cooking and gardening and basic cleaning. However, you must avoid quick reactive movements, like reaching out suddenly to catch a falling object. Regaining your independence feels great, but pace yourself. Even as you use the arm more naturally, the underlying tissue is still healing and remains vulnerable to sudden, heavy loads. Phase 4 begins at week 14. This is your window to rebuild the muscle mass you lost while in the sling by introducing resisted strengthening. You will start using elastic bands and light hand weights for targeted scapular exercises. Movements like kneeling rows and prone rows will train the muscles around your shoulder blade to properly support the joint. There is one specific motion you must avoid entirely. Do not perform the empty can lateral raise, lifting your arms straight out to the side with your thumb pointed down, at any single stage of this rehab. The empty can position pinches the tissues in the shoulder joint, causing severe impingement and placing destructive, localized stress directly on your surgical repair. Once you reach week 20, you enter Phase 5. The focus shifts towards restoring maximal strength, power, and athletic endurance. This animation shows functional eccentric strengthening during a diagonal band exercise. The muscle is actively lengthening while under tension, which builds the precise type of resilient strength needed for dynamic athletic movements. If your shoulder has not reached full, complete motion by week 22, your therapist will implement aggressive stretching techniques, specifically targeting the posterior capsule at the back of the joint. Working through these progressive strength steps ensures your shoulder is mechanically prepared to handle the unpredictable, heavy loads required for sports and strenuous labor. You have completed the 5-phase protocol and successfully restored the structural integrity of your rotator cuff. This is the reward for 6 months of discipline, the ability to execute explosive, overhead athletic movements with fluid mechanics and zero pain. To preserve these hard-won gains in your range of motion, you must maintain a daily home stretching routine permanently. As a final safety note, be aware of strict medical red flags. If you ever experience unresolving numbness, excessive drainage from your incision, or uncontrolled pain, bypass the protocol entirely and contact your physician immediately. By combining strict patience with phased progressive loading, you turn a delicate surgical repair into a permanently resilient shoulder.